Today, we're diving into an exciting study on reducing treatment delays in ischemic stroke. Let's jump right in.
I'm really interested in this topic. What's the main focus of the study?
So, it's about optimizing intravenous thrombolytic therapy for ischemic stroke by implementing a nurse-led strategy based on a timeline process.
I see. So nurses taking the lead in stroke management? That sounds promising.
Exactly. They developed a timeline process management system and formed a nurse-led stroke process management team to reduce delays.
How does the timeline process work?
Well, they used QR codes at key points in the treatment process. Nurses would scan these codes to log timestamps. It's like, creating a digital pathway for the patient's care.
That's innovative. So the QR codes help track timing?
Yes, exactly. By scanning the codes, they collected real-time data on door-to-CTA time,
Gotcha.
CTA time, and door-to-needle time, among others.
And this data helps identify bottlenecks in the process?
Right, and allows for continuous quality improvement. The nurse-led team coordinated between departments to streamline
Right.
everything.
That's brilliant. Nurses coordinating between emergency neurology and radiology departments.
Yes, and they also standardized the IVT therapy process, provided
Yeah.
training, and even introduced an incentive policy.
Wait, an incentive policy? How did that work?
They rewarded teams with the shortest door-to-needle times each month and quarter to encourage
Interesting.
faster treatment.
Did that significantly improve the times?
Surprisingly, the additional incentive policy didn't make a significant difference compared to the initial improvements.
Really? That's interesting. Maybe the team was already performing at their best.
Possibly, or external factors like the COVID-19 pandemic may have affected results.
Could be. Right, the pandemic disrupted a lot of healthcare operations.
Exactly. But overall, they saw significant reductions in door-to-needle time. It decreased from a median of 46 minutes to 30 minutes after the intervention.
That's impressive. That's a substantial improvement.
Yes, and more patients received treatment within the recommended timeframes.
Did they mention any challenges with the new system?
They noted initial difficulties in interdepartmental communication, but the nurse-led team helped overcome those barriers.
Makes sense. It's like having a central coordinator makes everything run smoother.
Exactly. And the QR code system reduced the documentation workload for nurses, allowing them to focus more on patient care.
That's a big plus. Documentation can be time-consuming.
Indeed. By generating nursing records automatically, they saved valuable time.
That's great. But I wonder, were there any limitations to this study?
Well, they acknowledged that it was a single-center study, so the findings might not be generalizable to all settings.
That makes sense. Replicating this in other hospitals would be important.
Absolutely. They also suggested adding time-consuming reminders in the future to further reduce delays.
Good idea. So what's the key takeaway here?
The main point is that optimizing IVT therapy with a nurse-led strategy and real-time data collection can significantly reduce treatment delays in ischemic stroke.
That's encouraging news. But do you think the reliance on technology like QR codes could be a barrier in some settings?
That's a valid concern. In areas with limited resources, implementing such technology might be challenging.
True. Maybe simple adaptations could be made, though.
Yes, perhaps even manual timing methods could help if digital systems aren't available.
It's all about improving processes to save time and ultimately lives.
Exactly. Time is critical in stroke care, and every minute saved counts.
Absolutely. I'm really impressed by this study. Do you think this approach could be applied to other time-sensitive treatments?
Definitely. The principles of process optimization and team coordination can benefit many areas of healthcare.
It's like when everyone pulls together, the whole system improves.
Yes, and patients receive better care as a result.
Exactly. Well, this was a great discussion. Thanks for sharing these insights.
My pleasure. I'm excited to see how these findings influence future practices in stroke care.